someone will ask you the same question, and that time you should be able to answer, because you are going as an experienced person, so they are expecting you to answer for the basic questions. Okay, so 1 minute. I hope everyone is able to see my screen, right? Yes, Shivani, Harshita, Anji.
Yes, sir. Yes, sir.
Yeah, for today only we are facing some latency because system is too much slow, but it will not be same picture every day. And even on Saturday, Sunday also we'll take a session. And if you are having any plan, then you have to take out time, because this training is not for 6 month or 4 month or 3 month. Okay, this is only for 1 month. Previously I used to take it only for 20 days, but now for your batch we'll spend 10 more days for your other activities, and so that you will get a job as soon as possible. Okay, so here we are working for hospitals in US. Okay, so hospital, multiple hospital are there, like we already know. You can compare with India also. Okay, so hospital is having different department. One of the department is medicine, right? If hospital is there, then they are having their own medicine shop or something like that. Then x-ray machine, or you we can UCG in short. UCG means x-ray, CT scan. These kind of machineries are there. Pathology, for blood report. Okay, like this. Some insurance or billing department is there, like if you have visited for your friend or any family member, then you saw that if our patient is in hospital for 1 week, then they used to create a single bill, and all the charges are there, right? So billing department is there. To You can visit that billing department, you can ask what means, how much charges they are charging for the doctor fees, everything. Okay, so we are working for this billing department. Okay, but nowadays we already familiar with the insurances. uh, Hospital charges are very high in India and in US also. If I give you the idea about the US, just for only example, okay, only for one uh, root canal for your tooth, they used to charge $2,000 to $3,000. So if you are comparing with the India or converting into the Indian money, then the charges will be above 1.5 lakh per tooth. This much expensive services are there in a US. So hospitals means multiple doctors are there, and they don't want to handle other department. They want to focus on their service, whatever their specialty. Okay, so this billing department, what they are doing, because in US all the health services are very expensive. 95% people is having health insurance. They are not paying. They are paying very small as per the insurance plan. And most of the bills means, for example, if you are working for one hospital and 100 patient are visiting every day, from that 95 patient is having their insurance, and more than 1000 insurance companies are there in US. We don't know which insurance company is there with the patient. Patient will come, he will take the service, he will provide his insurance detail, and he will leave the hospital. So this billing department work is, contact to his insurance company, send the claim form, and get the money to the hospital account. Okay, so we are a mediator between hospital and the insurance company, and thousands of insurance companies are there. Okay, so we are not dealing with only one insurance. Till comfortable what exactly I am trying to tell you? Yes, guys. Speak, guys. In interview also you have to speak. Hello, am I audible?
Yes, sir. Hello, hello.
Yeah.
Yes.
So, guys, you can keep
Hello.
yourself as a unmute. And if you are having any small queries, don't think about other person in the batch, because you have to attend the interview. You have to crack the interview. If someone is asking you the question, you are only the person in interview who have to answer that. And now this everything is new for you. So if you are having any small query, for example, if I am using any small shortcut like this example, and if you don't know the long form for this three character, you can ask this also, because everything is new for you and you are going as a experience, so you should know everything. We'll spend more time. I'll explain you in different way by giving different examples, but the main motto is you should be clear with the concept what I am trying to tell you. So till now everyone is comfortable.
Yes, sir. Yes.
So we are a mediator between whom? We are a mediator between hospital and the insurance company. Okay. For example, you know, sometimes if you have taken any loan from the bank and you are not paying, there is some different company who will reach to your home and ask you the money. Okay, or they will provide you some notice. Okay, that is the third party. Here also the hospital where the patient are taking the service, they are providing their insurance card, but the insurance company are different. Okay, so this insurance company, first of all we have to see which insurance company is there with the patient. To that insurance company we will reach, we will send our claim form, and then insurance company will see that whatever services patient has taken, those are covered in the patient plan or not, and then they will pay to the hospital. Okay, till now comfortable?
Yes.
Okay,
Yes, sir. Company. Yes.
so if you are having any query you can stop me anytime, and definitely, because tomorrow if I am asking to someone, you should try to answer me. In interview also someone will ask these kind of basic questions and you should be able to answer that time. So this is the good platform if you are trying to answer. Okay,
Sure.
so see, we'll compare with the Indian hospital. You also know that we are taking any insurance, multiple insurances are there in the market. For example, simple example is everybody is having two wheeler nowadays. So the bike insurance is compulsory, car insurance is compulsory. If you are traveling from train, then you will get a message uh, from the one of the insurance company, and the amount is very small for the insurance, like 1 rupees. But something is happen in the journey, then your family will get some bulk amount. Okay, so if you are keeping any money or the gold in the bank, security insurance is there. If you are having any warehouse, then uh, some fire insurance are there. Something happen, then insurance will cover. Okay, like this, so many insurance plans are there, and a single company can sell these products. Uh, as we are familiar with the insurance companies in India, so tell me some insurance companies name if you know.
LIC.
Okay, LIC, right. This is the our
App.
government insurance company, right. Any other?
Yes. Sriram Chips.
Yeah, Sriram. Good.
Hmm.
Any other?
Kapil Chips.
Bima Insurance Officer.
Bajaj. Right?
Hmm.
United.
Hmm.
Like this. So many insurance companies are there. So will these companies are selling their products, multiple products, according to the requirement of people. Okay. So see, healthcare insurance is there, general insurance are there, right? People are investing their money into the insurance so that they can save their taxes, right? And after some year, 10 year, 15 year, they will get a bulk amount from the insurance company. Dental insurance is there, security insurance, fire insurance, auto insurance, traveling insurance, as I already mentioned most of these. Now we are going to focus on only healthcare insurance. If you are working for any hospital which is the dental hospital, then that time we'll focus on dental insurance. But the working style is same for the healthcare insurance and the dental insurance. So at this point, for our training, we'll focus on healthcare insurance. Okay. Now the next part is, if you are talking about a single doctor, he is having some specialty. And if you are talking about any uh, big hospital where multiple doctors are there, that means multiple specialities are there. One of them or two of them are neurologists who are giving services for brain related things. Pediatric means uh, below 5 year children. Gynecologist is there for female. Orthopedic means our bone related services. Cardiologist is heart related services. Like this, multiple doctors are there in the multi speciality hospital. So at this point, we'll consider, we don't know for which company you are going to get the job and what project they are having, for which specialty they are working. We don't know anything. So what we'll consider, we are going to work, or we are going to work for a company where their client is for the multi speciality hospital. This hospital is having multi speciality, that means multiple doctors are there. Okay. So we are working for this hospital as a billing department. Okay. So interviewer will ask you, this is one interview question. They will ask you, for which specialty you are working currently. Okay. So you can do one thing, everyone. You can create a small notebook. Anyhow, I am going to provide you the notes, but notes will be in your mobile only, because I have good experience. I am having so many notes in my mobile. But if you are reading that again and again and implementing and trying to remember, then only I can answer for those topic. Otherwise, those notes will be in your mobile only. Nothing will happen. Okay. Everybody is watching your miss our favorite movie, we have watched more than 5 times, but still we are not actor or actress. Correct? The same thing will happen here also. You will complete the training, all the notes with uh, in your mobile, but you will not get a job. Why? Because you have not spent time, you have not tried to remember these things. Okay. So first question, you can note down, interviewer will ask you for which specialty you are working in your current company. So you have to tell them, currently I am working for multi speciality. That means multiple specialty doctors are there in our client hospital. Okay. This is one interview question. And 100%, uh, 10 out of 10 interview they will ask you, because accordingly they will ask you the question. For example, if you are telling any particular specialty, for example, you are telling that currently I am working for orthopedic, and by mistake they are also working for orthopedic, they will ask you deep question. So from to save from those kind of question, we'll tell them that we are working for multi speciality. so that they will not focus on any particular specialty and they will ask you only general questions. Got it, everyone?
Yes.
Okay. Now, as I already mentioned, there are so many departments in the billing company. I'll tell you how many departments are there. Okay, and for which department we are going to work. So don't think that for which profile you are working, you are only the person in between the hospital and the insurance company. No. How many boxes are there in the image? These many departments are there on your floor. Some of them are working in day, some of the department are working in mid shift, and some of the department are working in night shift. So we are going to work for this department, that is the denial management. Okay, so one by one in coming session we'll understand about every department. Okay, this is also one of the interview question. Explain the RCM cycle. RCM means revenue cycle management. Okay, so if such kind of question is there in your interview, that means you are having two or three question only in your interview. Because if you are trying to explain this RCM cycle, it will take 15 to 20 minutes, at least 15 minutes. If you are trying to talk two lines for each department, then also it will take near to 15 minutes to explain the working for each department. And by answering, the interviewer can understand how much you know about the all the department, even though you are working for denial management. And then after that, hardly he will ask you two or three question, and he'll wrap up the interview. But very few interviewer will ask this question, explain the RCM cycle. But we should be ready with this answer also. So we'll see that. So here we are going to apply for this denial management department, where our profile is AR caller. Okay, so as you know, if you are going to any hospital, you can expect a bill from the medicine shop. Different bill, you can get a pathology bill, you can get a x-ray report bill, you can get a hospital charges bill. Hospital charges means if your patient is in hospital for 1 week, 2 week, then the room charges are there. Multiple things are there in the hospital bill. And doctor fees is different thing. Like if any doctor is coming from outside and he is just checking the patient, that means the doctor charges, it is called as physician charges. As you know, if you are going to your family doctor also, we means everybody has visited to the family doctor, and sometime they will ask you to do some blood report, blood checkup. And if the blood checkup facility is not there, they will write down the what report you have to take out. They will give you the list of means what exactly you have to test. Then you will reach to the pathology, you will get your report, and you will come back to the doctor. The doctor will see the report and accordingly he will prescribe you. This happen with everyone, correct?
Yes.
But here we are paying for two things. We are paying for doctor to read the report and to give the prescription. We are also paying to the pathology for doing the test, correct? So two charges are there, different charges are there. So doctor fees is called as physician charges. And different other thing is hospital charges. Hospital means patient is in hospital for 1 week, so hospital bill is different, and the doctor fees is different, who is giving the services. One example is heart surgery. ICU is there, okay, and all the machineries are there. That means machinery charges are part of the hospital charges. But who is providing the service, that doctor charge is different, that is called as physician charges. So here in US also two charges are there. hospital charges and the doctor charges. So we are going to focus on hospital charges because most of the opening in the market is for the hospital, physician charges. We are going to focus on physician charges. Why? Because hospital bills are very big. Very big means more than $20,000, $30,000. If you are convert that into the Indian money, that that will be a big amount. So hospital, they don't want to take a risk with the big amount bills. In some company you can see hospital billing also, but the mm, if we compare the physician charges opening in the market and the hospital billing opening in the market, then most of the time you will see that physician billing opening is there. Okay, so the working style is same, don't worry. For whatever we are going to learn, the same thing will apply for the hospital billing also, and you can apply for hospital billing also. The good part is you can tell them that currently I am working for physician billing, but I can work for hospital billing also if you provide me any small training so that I can understand. And they will provide you minimum 2 month training after joining, because they considered you are having basic knowledge, but you don't know anything about the hospital billing, so they will give you training from zero. So again you will be in training for 2 months. And in some company there is a format, even though you are having experience, 1 month training is compulsory for everyone after joining. Like Wipro is there, R1 RCM company is there, Inventures company is there, Access Healthcare company is there. So these company, what they are doing, whenever any person is joining their company, the mandatory training is there for 1 month. So you will be in training after joining. Okay, so we are going to focus and learn for the physician billing. Okay, so this is also one of the interview question. Are you working for hospital billing or physician billing? So without any delay, you should answer. Currently, I am working for multi-speciality hospital, and we are working for physician billing. Noted? Yes, guys.
Yes, sir.
Okay. So as I already draw here, what we are mediator between hospital and the insurance to get the money from the insurance, whatever services we have provided to the patient. Okay. So first of all, we have to send the bills to the insurance company. So for example, patient is in our hospital for 2 3 days in US, because we are going to work for US hospital. In US their reports are in very detailed. Even though in India also you can see that whenever you are going to hospital and the patient is in hospital for more than 3 4 days, multiple reports are there in the file. Prescription is there, blood report are there, x-ray reports are there, doctor notes are there, right? History report are there if patient has already visited in another hospital and now coming to the this hospital. So these kind of things are there same in the US, but their detailing is more than India. If we are seeing 10 pages in the report in India, we can see 30 to 50 pages are there in US for the same thing, because they are noting down every small point. Okay, and that is called as medical records. So we cannot send all these 30 to 50 pages to the insurance company to get the payment. Okay, as a billing company or as a billing department, we are not sending those medical records or all the files to the insurance company to get the payment. So what we are doing, we are just sending the claim form. 1 or 2 pages claim form is there. We'll see that in detail. So we used to send the claim form, and then insurance will see the claim form, what services we have provided, and then according to the patient policy they will process and they will pay. For example, here patient is having dental insurance and he has taken normal services. This dental insurance will cover only dental services, it will not cover other services. So dental insurance will not pay and they will deny as a patient responsibility. Okay, so those things we'll see. So as of now everybody understood, we are not sending medical record to the insurance, we are sending only the claim form. Okay, and there are two claim form. As I already explained you, two different charges are there. Hospital charges, that is called as hospital billing, and other is the physician charges, also called as physician billing. So we are going to focus on physician billing. Okay, for hospital billing UB04 claim form, you just have to remember the name. No need to remember the long form and all, because we are not going to focus for the hospital charges. Okay, it is having 84 boxes, you don't have to remember this. I'll tell you what is important and what you have to remember. So you just have to remember UB04 name is there for the hospital billing claim form, and another claim form is there, and these claim form are all over US. For all the states same claim form is there. In India different thing is there, like LIC insurance company, they are having different claim form. Shriram company, they are having their own claim form. If you are sending LIC claim form to the Shriram, they will not accept. Bajaj company, they are having their own design claim form. So every company is having their own claim form in India, but in US the only two claim forms are there, and it is designed by US government. Some department is there, we'll see that. And every insurance company have to accept only this claim form, and every hospital, every doctor have to send this claim form only, they cannot use any other claim form. So for doctor charges, the claim form name is CMS 1500. CMS 1500, that is the Center for Medicare and Medicaid Services. Because we are going to focus on physician billing, we should know the long form for the CMS, that is the Center for Medicare and Medicaid Services. In detail we'll see that. And it is having 33 boxes, and this claim form is having one more name, that is the SCFA, Healthcare Finance Administration. You cannot say Healthcare Finance Administrator, your answer is wrong. Sometime interviewer will ask you, tell me the long form for HCFA, and if you are telling the answer as a healthcare finance administrator, they will reject you. If you are telling the answer as a center for Medicaid and Medicare services, that is also wrong. Answer should be centers for Medicare and Medicaid services as it is. Okay, so everybody now know what claim form we are going to use. CMS 1500 for physician billing. Now in India multiple states are there, in US also multiple states are there, and at this point we don't know for which state we are going to work. So at least one state name you should know, any, so that interviewer, if they are asking you for which state you are working, you should know the state. Okay, so for example if I am telling Texas, so you should know, in short we used to write as a TX. California, this is state. Illinois, Florida. Okay, so one of the state you have to remember. Okay, so you can create your speech. I am working for physician billing, we are using CMS 1500. Okay, and currently we are working for multi speciality hospital, and we are working for California state. Like this you have to remember, so that if they are asking you, you should have the answer. Okay, you cannot try to remind yourself that what need to answer, because you are currently working, you are telling them. Okay, so if everybody is comfortable, then I'll continue for 10 more minutes. If already
Okay, sir.
excess, then we can stop.
Yeah, okay, sir.
No problem,
Okay,
sir.
sir.
No
Okay,
problem.
and that is fine. I know that for next 1 month we are here, so don't worry, we'll see this again and again. Okay, because everybody is having gap from the education and current, so we cannot go as a fresher. who is having 2023 year pass out, they can try for fresher. But who is having more than 1 year gap, we should not go as a fresher, because for fresher maximum salary is 15,000. Okay, so we are expecting salary near to 30,000. Okay, so you can uh, whatever time you can spend here, you are doing it for yourself, you are not doing for someone else. If you are getting 30,000 salary, you can spend whole salary in a month, because you know that again on 30th or 1st again you will get the salary. Okay, you can do multiple plans with that. Okay, so we'll continue. So as I already mentioned, we are, as a billing department, we are sending claim form to the insurance company. So how we are sending claim form? First of all, I can show you how the claim form is looking like. Okay, as I already told you, sample CMS 1500. We are using CMS 1500 form. Okay, so this CMS 1500 form all over US is same. Access deny, will go for next. Okay, so see, this always it is in reddish color. Okay, this kind of claim form is there all over US. Second page is only for the instruction, and the first page only one page is there. Total 33 boxes are there. 33. Interviewer can ask you how many boxes are there in the CMS 1500. These kind of small questions are there, basic question. Hardly 7 to 8 question they will ask you, maximum 10 question ask you. And till now 3 question we already saw. For which specialty you are working, for which state you are working. Okay, and are you working for physician billing or hospital billing, which claim form you are using, how many boxes are there in the claim form. Okay, so like this I'll give you the list of question and answer at last. Okay, so this kind of claim form are there, and this claim form is the unique claim form because there is a barcode, so we cannot use the same claim form for multiple patient. Okay, so this claim form we are sending to the insurance company. For example, one insurance company, now I'll tell you the list of insurance company in US, because some interviewer can ask you frequently which insurances you are handling. So you should know at least 5 to 7 insurance company names. Okay, so Medicare is there, Medicaid, Cigna, Aetna, BCBS, Blue Cross Blue Shield. Okay, then UHC. Like this you can search the list of insurance company, or in coming session we'll see multiple insurance company. So first of all, as a billing department, we'll see which insurance card has been submitted. Okay, it is for the Cigna insurance. Then we'll send the insurance claim form to the Cigna only. Yeah, anybody is having question? Nobody is asking anything? Anji,
Sir.
Shivani, Archita, everybody should have some
Yes.
question, like you should have some curiosity, because interviewer will not give
Oscar
you the
is
answer. Yes, any question?
Oscar is an insurance company.
Sorry, Anji, call you. Can you ask loudly?
Oscar, sir. Oscar is a insurance company.
Which one?
Yes, insurance company. Medicare, Medicaid, Cigna, Aetna.
These are the insurance companies.
One more
Oscar,
Oscar company. Uh,
Oscar. I have to search.
okay, okay,
Yeah, I'll tell you. But
okay.
whatever we have covered from that, if anybody is having question, then definitely ask. Harshita, Shivani, Subhi, any question?
No, sir. No.
Okay. So you can note down in small copy. Okay, I'll give you
Okay.
a standard notes which you can go through that. Okay, so how we are sending this claim form to the particular insurance company? Multiple ways are there. One is I can send through courier company a hard claim form. I'll fill all the details in this claim form. I'll fill all the details whatever services patient has taken, and I'll print this and I'll send it to the insurance company through courier company. Okay. Other is I can fax it. uh, Third one is I can upload on their website. Fourth is I can send electronically, how we are sending email and all, right? The same way we can send a claim form through electronically. These four ways are there to submit our claim form to the insurance company. And you have to remember, nobody will ask you, but you have to remember how many ways are there to submit the claim form: electronic claim form, paper claim form, through fax, or sometimes, if available, then on the insurance website we can upload. Okay, everyone is clear the ways how we are
Yes.
sending to the insurance company? Till now we know only three ways. Paper claim form we are sending through courier company. Fax means we should have the fax number, then we can send to the fax. Now this fax nowadays is the e-fax. It is not like the old fax machine is there and then we are uh, I don't know you guys know fax machine and now, but nowadays it is electronically only. Instead of sending email, how we are sending the email, you should have the email address. The same thing is here. One portal is there to send the fax, and actual fax machine is not there. Instead of email address, fax number is there, some 10 digit number is there, and we can use that fax number and we can send the claim form. And the web portal where we can upload on their web portal. These three ways we are clear, right? Now
Yes.
we'll see the fourth one,
Mhm.
which is the most preferred way. Okay, because why preferred way, I'll tell you. uh, Second, third, and fourth, everybody clear how we are sending the claim form?
Yes.
Yes.
Okay, great. So paper claim form will take 15 to 30 days to reach at insurance, because we are sending through courier company, so it will take multiple days. Like first of all, that courier will go to the local office, then the city office, then district office, like that. It will travel and it will take more time to reach to the insurance company. How we are getting our parcel from the any courier company, obviously it will take more time than the email, right? Email will go in the second, right? Quickly email can go, but if you are trying to send a hard copy through the courier company, definitely it will take more days. So okay, we'll consider as a 5 days to 30 days, depend on the distance from the hospital to the insurance. Next is the fax. It will not take more time. In 1 minute only we can fax it, and on website also we can upload quickly. But the thing is, whenever we are uploading, some insurance they are having automatic process, or sometimes even though you have uploaded, it will take more time to process that claim form. So these three things are taking more time than what? Than the electronic way. This is the most preferred way and this is the fastest way. And insurance company will prefer to accept the claim form electronically, and hospital can expect a payment in 3 or 4 days only. But paper claim form, it will take already more than 5 days to reach to the insurance company. Again they will take 3 to 4 days for processing the claim. Again they are if they are paying, then again if they are sending check through courier company, again it will take 5 to 10 days to receive the check. So we can expect that at least 20 plus days will require to get the money in the bank in hospital, right? So that is the reason everybody is preferring for the electronic fax and website. These options are for very few company, it is not for every insurance company. So every insurance company is having only means most of the company, 90% companies are having these two uh, ways to accept the claim form, and we are preferring to send through electronically because we want money as soon as possible. Got it? So this is the electronic way. So how we are sending the email? We should have the email address. So how we can send the claim form through electronically? We should have the electronic payer ID. So what is mean by payer ID? It is the 5-digit number. Okay. UHC insurance ID card. We'll see sample ID card, and you can see the electronic payer ID is there on the ID card. And every insurance company, they are having payer ID on their ID card. You can see here payer ID 87726. Like this, every insurance company on the insurance ID card, they used to mention the payer ID, so that whenever any hospital or doctor want to send the claim form through electronically, they should use this payer ID to send the claim through electronically. Everybody understood how we are sending the, means by what using we are sending the claim form through electronically? Yes or no?
Yes, sir. Yes, sir.
Okay, so nobody will ask you the payer ID, don't worry, but at least you should know how we are sending the electronically claim by using electronic payer ID. It is not easy to remember the payer ID for every insurance company. And United Healthcare is the big group, they are having different plan. So maybe possible that for different plan they are having different payer ID. It is like the email address only, but it is in the form of number. Okay, so exact number we have to use in our system, then only it will go to the exact correct department. If you are using wrong number, then it will go to the wrong insurance company. Understood?
Yes, sir.
Like this ID card, you can see that the insurance who the subscriber name is there, insurance ID is there, dependents are there, like children or wife. Okay, and then uh, group number is there if it is a group plan. Okay, and some other details here, like the customer care number is there for the member. As a provider we are working, right, as a billing department, so for us this is the number, not this one. We should not call to the for member number, always we should call to the for provider. Okay, then where to send the paper claim form, on which address we have to send, the address is there. Okay, like this multiple information is there on the ID card. So I have just type for the UHC insurance. You can see for every insurance ID card we can get that payer ID and other details. In every insurance company they have to provide that detail, then only we can send our claim form to the correct insurance. So we'll see where is the payer ID. Okay, address is given, payer ID. I'll open one more card. 1 second. Let's see. Member ID, group ID, effective date means when the insurance has started. Okay. But don't worry, in live, whenever you will see the ID card, you can get the payer ID. Don't worry. Okay. So even though in sample ID card we are not able to see for the BCBS, but in live, whenever you will open in the system, you will get that detail, don't worry. So as we saw in the USC, clearly pair ID is mentioned, like that you can see. So till now we covered how many type of insurances are there, what kind of specialties are there in the hospital. uh, as a AR caller we are going to work for the denial management, and how many bills are there, and what all are the ways are there, and how many means what kind of state you are working. Like this, more than 26 states are there in the US, so at least one state you have to remember. So till now, just go through it, remember whatever you can remember, and tomorrow if I am asking, without seeing notes, try to answer. Okay. And after
Okay.
1 week or 2 week, you all can do one activity. I'll give you the interview question, whatever part we have covered. After 2 weeks, I'll give you the interview question, and one of you can ask the question to other guys, and that activity is only for 20 minutes before our session. For example, Anji is asking to the Shivani, then Shivani will try to answer that without seeing the notes. If you are not able to answer, that means in interview also, live interview also, you will not be able to answer that. So you have to practice it before going to the live experience, live interview. Okay. So it will really help you to crack the interview. And what, don't worry, if you are not able to answer, you can write down that question, note down that, and you can again study on that, and tomorrow, next day again you can try to answer that question. Okay. So this activity I used to prefer to suggest to the every batch, and till now more than 150 student I have placed. Okay, these are my previous batches. From 2018 I am taking, you can see the dates, right? So from long time we are taking these sessions. So I'll help you to get this job, don't worry. Everybody is comfortable.
Yes. Yes, sir.
Okay. Apart from our session and training, anybody is having any other